and correct the wrong ones that you've made. Once again, welcome to Mainland 98.3 FM, the sound of Lagos. I'm Sage Babalola, and this is Mother and Child. Mother and Child is a weekly radio program where we spend time focusing on the health, the safety, and the welfare of women and children in our polity. We understand that the maternal and neonatal mortality figures are something to worry about, and so in our own little way, we engage the services of experts across medical fields, and we try to have them sensitize us on the best way to manage these conditions, and also in our own way minimize or maybe even attempt to eliminate conditions that usually lead to the surge in the amount of maternal and neonatal mortality figures. Well, today we're going to be focusing on something that is of grave concern. We're talking about HIV, AIDS as well, in commemoration of World AIDS Day. It's usually highlighted on the 1st of December every year. Now, each year on the 1st of December, the world commemorates World AIDS Day. Now, people around the world unite to show support for the people that are living with HIV and to remember those who have died from AIDS-related illnesses. Now, each World AIDS Day focuses on a specific theme, and this year's theme, Take the Rights Part. This year's theme further highlights the growing list of challenges that World AIDS Day has alerted people to globally. Now, on a global scale, we have an estimated 1.3 million women and girls that are living with HIV, and they become pregnant. And in the absence of an intervention, the rate of transmission of HIV from a mother to her child from labor to delivery is around 15% to 45%. And we've seen a surge in pediatric cases as well, HIV, about 300 deaths on a weekly basis. So you can understand why this is cause for concern. Well, joining me in the studio this morning to talk about HIV/AIDS in itself, mother-to-child transmission, how to prevent or maybe even minimize this transmission is Tosin Akinriade. He's the Programs and Evaluation Officer at NUBCAA, that's the Nigeria Business Coalition Against AIDS. And we have Nkechi Omojafo. She's the Assistant Marketing and Fundraising Manager at HIV Trust Fund of Nigeria. It's a pleasure to have you both in the studio. Good morning to you.
Good morning.
Yes, I hope I said your name correctly.
Absolutely,
okay,
yes.
I make it a point of duty to say people's names right. Thank you so very much for joining us. So let's have a conversation. Let's start from the basis. Although our focus for this morning is, of course, mother-to-child transmission, but people should understand the foundation of this condition in itself. So talk to us about HIV and AIDS. This is a concept that people use interchangeably. They don't know the difference between these two conditions. So what is HIV, and at what point does it become AIDS?
Okay. Good morning.
Good morning again.
Thanks for having us here.
It's a pleasure.
Okay, so people actually, just like what you said, people actually confuse the term HIV and AIDS, and we still have this question: is it still in existence? Are people still living with HIV? Yes, the answer is yes. Okay, so as we all know, HIV is the human immune deficiency syndrome, and is a virus that attacks the body's immune system, specifically the CD4 cells, which are crucial for fighting infections. Yeah, so it's paramount that we have key features of this virus. Okay, so HIV is still a virus, but when it gets to full-blown AIDS, then it's actually it's a disease, an infection in itself, yeah? But it doesn't kill. HIV is not a death sentence.
I'm sorry, I apologize. Do you mind coming closer? Apparently people are not able to hear you properly. All right. Would you say something for me, please?
Can you hear me now?
Yes, perfect. Go ahead, please.
So, of course, we all know the modes of transmission. We have unprotected sex. We have, it could be blood transfusion, maybe not properly done. It could be using unsterilized equipment. So most people feel it has to be sex. But yeah, sex or having sexual intercourse without having the right protection is actually one of the features, right, of HIV/AIDS amongst others. Yeah, while we have AIDS is the acquired immune deficiency syndrome, right? So that at that point the infection is full blown in the human system, right? And at that point you need to be on medications, antiretroviral therapy, and also constant therapy generally, so that you don't get most people that have HIV or AIDS, they feel there's this stigmatization. They actually don't want to get themselves acquainted. It's not a life death sentence. It's something you can as well live with. But the most important thing is, for HIV, it's a virus, so you can as well start treatment. For AIDS, it's full blown. So at that point, your immune is affected. So you need to make sure that no other infection comes to play, in your system, because now what does it do? It attacks your immune at that point. Yeah.
All right, let's have a conversation about the risk factors and the signs and the symptoms. What are the conditions that predisposes a person to have HIV, and what are the signs and symptoms of HIV? And when it becomes the full-blown AIDS, what are also the factors that indicate that this is actually AIDS at play?
Okay. For HIV, like my colleagues earlier said, that's actually the early stage before it's actually full-blown to AIDS. So usually the common symptoms you usually get for the HIV at the early stage are usually just fever, fatigue, maybe sore throat. But usually this is why we also always encourage for periodic testing. Yeah, so people get to test themselves. This is actually free, so it is usually very, very important to get periodic testing. So in and out, you know that okay, you are just free from this because a lot of people might just get these symptoms and just think it is normal. And trust me, I don't think any symptoms is actually normal these days. So it's always very, very important to actually get yourself tested, and also in and out of health facilities to just find out about any symptoms that comes around is actually going to be very, very important as well. So and for risk factors, like my colleague said earlier on, unprotected sex is actually one of the key to young people, because these are people that are more prone to risky behaviors. So we preach to them to let them understand, give them more sensitization on HIV and AIDS, because we believe they are more prone to risky behaviors. And another thing is sharing of needles, unsterilized equipment as well, like she said earlier on, and blood transfusion, some unverified blood transfusion as well. So these are a little bit of risk factors that can actually prone to HIV.
All right. We'll go back to talking about AIDS, but then I just wanted us to lay the proper foundation. The focus this morning is actually mother-to-child transmission, but I wanted us to start from the beginning and understand how it manifests in the general populace then in mother and children. So we might as well just get into the conversation. Mother-to-child transmission. We understand that a woman being pregnant means that everything that happens in your body, from the food that you eat, even your blood, the fluid, everything runs through that child as well. And we can see that the figures are alarming, right from even the pregnancy period, labor when she gives birth, even to breastfeeding. These are very critical stages. These are the stages where the virus can be transferred from the mother to the child. So talk to us first of all about the alarming figures that we've seen, the transmission figures, and how exactly that transmission happens from the mother to her fetus and subsequently her child when she gives birth.
Okay, thank you very much. Okay, so MTCT, which is referred to as mother-to-child transmission, refers to the transmission of infections or diseases, right, from a mother to child. It could be at the point of maybe during childbirth. It could be at the point of breastfeeding, It could also be even while she's still pregnant. And at the HIV Trust Fund of Nigeria, that's our main focus. Our main focus is PMTCT, which is pregnant mother to child. The statistics are really alarming. So, like I said earlier when I kickstarted, people really do not believe that it's in existence. So the question is, why am I helping a pregnant woman that has HIV/AIDS or that has the infection, right? So probably she had it through unprotected sex. So what has that got to do with me? But the truth is, we are trying to save a generation. We're trying to save that child, that innocent child that, really has no, he doesn't have an understanding of what's going on, right? The rates are quite alarming. We had a recent development of a child that passed on in Benue State, right, as a result of the virus. So he was given birth to with the virus, and he lived with it, right? And in this state, they really do not have access to proper treatment, and he lived with the virus, and at the end of the day, when his immune couldn't hold on, he passed on. So the truth is, pregnant mothers without the proper care and treatment give birth to these children that are down with the virus, and without proper treatment or access to health care or health facilities or the right medications, such a child is exposed to, it could be death, it could be, there's so many factors, right? So that's why at the HIV Trust Fund of Nigeria, we are passionate about looking at the statistics and trying as much as possible to curb down on it. Now, how do we do that? We try as much as possible to identify these women that are pregnant. We reach out to companies, institutions, right, to more like support our cause. The most important thing for us is to save the life of that child, right? We reach out to private institutions, companies, individuals like you and I also, companies that conduct CSR, companies that, have this philanthropic,
Mindset.
means, or mindset of helping, and also individuals too. But like I said, we are still faced with the challenges of, are you sure we have pregnant mothers down with the virus?
Well, if you're just joining us, this is Mother and Child on Mainland 98.3 FM. We're having a conversation around HIV awareness with emphasis on mother-to-child transmission. It's in commemoration of World AIDS Day that is highlighted on the 1st of December every single year. Here in the studio, we have Tosin Akinriade, Programs and Evaluation Officer, Nigeria Business Coalition Against AIDS, and Nkechi Omojafo, Assistant Marketing and Fundraising Manager, HIV Trust Fund of Nigeria. We kick-started by talking about HIV when it becomes AIDS. We talk about the risk factors, the signs and the symptoms, and then we spoke about mother-to-child transmission and the fact that we still have a large population of people that don't even believe that pregnant women can have the condition. Having HIV does not in any way necessarily impede your fertility. People that have HIV can get pregnant, and it's possible to transmit this to their unborn child either at the point of delivery, during pregnancy, or during breastfeeding. So let's talk about how we can prevent it. Since we know it's common knowledge, it's not like there is a lack of knowledge about the possibility of transmission from mother to children. The statistics are there to prove it. How then can we begin to prevent the transmission of the virus from the mother to the child right from the moment where she sees that she has conceived, from the point of conception? What steps, what actions, healthcare practitioners, amongst other things, what are the steps that they take to make sure that the virus doesn't go from the woman to her fetus and ultimately her child?
Okay, thank you very much. Okay, so it's important for a pregnant mother to have both the pre and the postnatal care. Very important. And what does that entail? It entails focusing on the health of the mother. So she's the one carrying, the child or the fetus in her womb. So her own, she needs to take care of herself. That's the most important thing, right? So that she can as well protect the child. Because there's every possibility that the mother could have it and then she conceives her child after 9 months and the child is negative. It happens, yeah. So the most important thing is early and consistent use of the antiretroviral therapy is very important for a pregnant mother. And then it's also important to have close monitoring. So we have some states in the north that we've had cases whereby, this pregnant mother is not having access to health care, and it's more like a consign. Right? So for those that, while that is being taken care of, for those that have access to healthcare, it's very important that, they are being monitored. So whatever hospital or whatever means you're using, there has to be monitoring, there has to be evaluation. Then screening for other infections is also a very vital point. So you could be taking care of the HIV virus and you could still be battling with other infections. And if it's not properly treated or taken care of, it could affect both the child and the mother. So while, this treatment is ongoing, it's important that you also check for co-infections. Then nutritional guidance. What do you eat? What does the mother feed on at that point? She needs to make sure that she has the right nutrients, right? So that in as much as she's receiving treatment, every nutrient is important for the child, for good development. So it's also important that that is being taken care of. Then we also have, there should be adequate planning for delivery. Yes, because at that point you don't want to infect, at the point of delivery there's every transfusion of blood, there's so many things being done. So at that point of delivery, care needs to be taken to make sure that no other person, can get in contact with the infection at that point. And then postnatal care, even after she has given birth to the child, she needs to also continue. She needs to make sure that she, because she's breastfeeding at that point, so she needs to make sure that she has access to treatment. She needs to be dedicated with her medications, right? She also needs to feed properly, because whatever you feed on is what you transfer to the child. Yeah.
All right, then. Just be aware that we're streaming the program live on Facebook and on YouTube. So if you're unable to listen directly via your radio, you can join us via social media, Facebook, YouTube, at Mainland 98.3 FM. Click on the live stream. And the beauty of that is that you get to comment under the live stream. If you have questions, contributions, suggestions, or what have you, just leave the message under the chat option, the live chat option on our live stream, and we would tend to those questions before our guests leave the studio. So 𝐴ᴏᴜᴜ, let's talk about stigmatization. A lot of people, I know that there's a problem with access to healthcare, especially in rural areas. But then again, we've been able to see some progress, especially in some urban centers, and we've seen mobile clinics being taken to these places. But even with the availability of help, a lot of women, because of shame, because of our cultural, religious beliefs and what have you, would not open up about their condition, and it will become AIDS. Their child is affected, they're both going through a difficult time, and nobody's there to help them. So talk about stigmatization and how this has become a catalyst as to why we have more quiet mothers who are going through HIV and are actively pregnant.
Yeah, thank you very much. I think stigmatization is actually one of the main thing that we're actually fighting against. I think for which HIV healthcare workers. So people just have this misconception that HIV is a death sentence. You just hugging people, talking to those people, you get infected with HIV and AIDS, but that's not true. So the stigmatization has actually just gone a little bit overboard, especially in remote areas, people that don't have access to healthcare, like you said. So it's actually very important for us to keep letting them know, keep creating more awareness, educating them on HIV and AIDS. I think when they have this improved knowledge, we're able to bring down attitudes of people towards stigmatization. So it's actually very important, and this can actually result into different things. It can actually result to social isolations. Mothers that have actually have HIV, they get to isolate themselves on public. They don't even want to let people know. They don't even going to the hospitals can be a challenge for them. So these are part of what we're actually preaching against. Let them come out, speak to their healthcare practitioners that you can talk to, people that will take you as family. We have community groups that you can join that can actually engage you and let you understand more about HIV prevention. So in fact, I think on today we have people that are actually very proud of how long they've lived after having this disease, and actually how they've been able to improve themselves being on treatments. I think these are people that are advocating for HIV and AIDS, letting people know that okay, you having this is not an HIV, this is not a death sentence. So like I said, another key issue that we need to do is education and awareness. Actually, is very, very important. Like I said earlier on, letting people know, especially in remote areas, that okay, you can come out. Let's stop the stigmatization against HIV and AIDS. Mothers who have this, let them come, especially so that we can prevent the transmission to their kids. So it's very, I think this is the main focus. Education and awareness is actually going to help in combating the stigmatization.
Let's talk about myths and misconceptions. I would like to talk about that as well. That seems to be your primary area of focus. Myths and misconceptions, aside from if you hug a person, you'd get the virus. If you shake a person, you get the virus, the most ridiculous ones. I believe that there's more you've heard about, considering the fact that you've related with a lot of these people. So what are the most ridiculous myths and misconceptions you've heard about HIV that you'd like to actively use this platform to debunk?
Okay. For me, I think one of the one of the most ridiculous ones I've heard is terms of using herbs to curb HIV and AIDS. I think that's very ridiculous. I don't think it's been scientifically proven that there's a certain herbs that you can take that can actually help you prevent HIV and AIDS. That's not true. I think the most important thing is just to get on the ART treatment and actually find your way to the nearest clinic. Another thing is hearing it that a certain group of people are actually prone more to HIV and AIDS. People probably LGBTQ or people that actually engage in dangerous substance abuse, they're actually prone more to HIV. I think that's not true as well. So these are a few of the myths that we actually and the fact that you said hugging, kissing, in fact even those you can even share what's the name, utensils with this certain people with HIV and AIDS, like we said. So it actually these are not ways to actually get infected. We've actually highlighted a few of that earlier on. So these are people that we can actually care for, move around them, engage with them. There is nothing to fear about, but we just have to keep encouraging them to come out. Let people also be aware of HIV and AIDS. So all these myths are actually not true. I think the most important to know is that you can actually get it through blood transfusion, dangerous sex intercourse, or not being protecting yourself as well. So this.
All right, let's talk about the role of community and family. We understand that the woman who's pregnant, her emotions are all over the place, hormones, and she needs support. She's pregnant. Her immune system automatically is even low because pregnancy tampers with your immune system. Children under 5 years old also have immune system that are not exactly 100% functional. That's why we advise that they get vaccinated and what have you. Unfortunately, there's no HIV vaccine at this time. So let's talk about the role of family and community. A lot of women that have HIV, for example, are ostracized in this community. They don't allow them in public spaces. They just keep them somewhere in the dark like some rabid animal. And so because of their emotions, the struggle of carrying a child, knowing that there is a possibility that you transfer this virus with your child is already overwhelming. And so a hand of support, a word of encouragement goes a long way, and a lot of people don't know this. So how do we convince the family, the immediate family, the community as a whole to not ostracize these women, instead hold their hands, support them, and also guide them through the process of delivery, taking care of their young one, and telling them that you can be a mother even if you do have the virus?
So in our experience over the years, we've come to realize that family and community play a very vital role, right? Family and community plays a very vital role in, trying to help these women. Now, let me take us back to the rural community. We've had challenges there. Why? Because, for example, you have maybe a husband that is not educated when it comes to, this HIV virus, right? And remember, in the north, they are open to marrying multiple women, right? And probably one of them is pregnant or she has the virus, and it gets to other wives, yeah, because when you have intercourse with your husband, automatically the other women also are exposed, right? And then at that point it becomes a problem because, for example, the moment you do not have proper education or sensitization about this, especially for those that are uneducated, it now becomes a challenge because they don't even understand what exactly they are supposed to do for you and to you. So how can you protect these women? How can you help them? So the first thing is knowing that this woman has this virus. Another thing is giving her the care and the support to make sure that, she doesn't probably lose the child in the process. And just like you said, emotions are up and down. It's at that point, she's at that point in her life where she's leaving her child. She's thinking of, so many things. So family plays a vital role. The community also plays a vital role. How? Making sure that these women have access to treatments. making sure that they have the means to transport themselves from one community to another. Because most times in these rural communities, they do not have the local health care there within their community. So having this woman to, transport herself to another community, probably far from where she is, at a point, she's tired. She doesn't even want to make that attempt or make that effort. Now, for communities where, they really lack maybe the finances, not having the funds and so many other, issues that they could face, it's important that as a community, what these women are identified and taken to the nearest health, care facility, yes, so that they could have access to treatment, so that they could also speak to them. Because, just like my colleague said, psychologically, it affects these women. So you need to also, don't run away from them. You understand? It's honestly is appalling when, you see a pregnant woman having this virus and you're making her feel she's going to die any moment, right? Give them the care. They need all the care, all the love, all the support that they could have at that point until they're able to conceive the child. And just like I said, most importantly, access to treatment. So communities, leaders, however, maybe whatever, maybe chiefs, however, your authority is in these communities. One, identification of these women. Two, getting them the requisite drugs, administration. What about the medical personnel? They need to be on ground. They need to be available to help these women. And if you have a community that thrives like this, honestly, people will come out and they'll get the care that is required. And, nobody is being stigmatized that, oh, I have the virus and I cannot be out there. No, that's thing will be out of it, and the world will be a better place for us to live in. Just like I said earlier, it's not a death sentence. People live with it. There's a commercial that, they say it's not written on the forehead, right? The most important thing is having this access to treatment so that, your what they call it, your viral load does not get suppressed. And with that, you can live a normal life, interact with people, have all the care and support. Most importantly, making sure that you're saving yourself to save others. Thank you.
Just to add to that, and that's why we actually advocate for everybody to actually be advocate for non-discrimination and inclusive environment for everybody. Everyone, the family, the community has to actually be an advocate for this. You have to be an advocate for this. I think that's part of what we preach in our organization. Everybody has to be an advocate for non-discrimination so that these people can actually come out. We can be able to encourage them, keep them, put them on treatment, and everyone is doing great.
All right, let's talk about the challenges that you face at Advocates yourself, right? Healthcare practitioners, I've had conversations with many of them. First of all, resistance to treatment. They're still dealing with vaccine hesitancy on its own. And there are a lot of people that don't believe that whatever treatment you're offering to them can do anything for them. I already have the virus. There's no cure. So there's nothing you can inject me with, or there's no amount of pills that you can pump me with that would do me any good. And so they would reject treatment. Healthcare practitioners have complained about that, and it takes them weeks on end to convince these women that we're here to help you. We're not here to exacerbate the situation at all. So as advocates yourself, people who actually go out, talk to these people, give them a sense of family, what challenges have you faced in conversing with the patients, these challenges?
Okay, so for one, language, not even understand the number when you're going for campaign, because
Right.
it's one thing to communicate, it's another home. So in as much as, you're giving people, because the truth, the problem we're facing, the government is because you need funds to take care of what you can do. They're trying to make sure that these women, my communication, people are crying out, please, is this the HIV? Touching and passionate. The most important thing is making sure that, because if these drugs are available, I can be a challenge.
Okay.
See how we can support people. They go there, and that's where we test kits, but how do we sustain it? That's where the question free. We go to, what happens? How do we also, and also individuals, it's more like a I think the last one, once you get how did they get it? You and I, we are now also trying to see how we can, as we calling on individual here, we are seeing it. And
Imagine that you're talking to people that actually are dear child. They're scared that how would I breastfeed?
Okay, there's always a way out. So, my healthcare practitioners that can actually listen to them. There is help. There is actually help. In as well trained, but still, for this out, let they are able to support it. They can actually
Campaign.
Yeah. So let's encourage them so we can all
Prevent or attempt to aid mothers from that and act the letters and HIV trust to give people an idea handle so they can
Instagram are also right as
HIV trust for
Instagram activities. This is part let you improve your knowledge on HIV and AIDS.
That's good. We just might work with you on that Love is Safe initiative so people know that they need to protect themselves. Now, Buka, by the way, is NIBUCAA. Some people might struggle with acronyms. So NIBUCAA is how you get Buka on their social media platform, and HTFN is HTFN. So that's a lot easy. Thank you so very much for being here, Tᴜɪ̀ᴜ in case you're Majafo. It's been a pleasure. We need to leave the studio now. Mother and Child airs every Monday from 10:15 to 11 a.m. Next week, we might just have, this is about the health safety of women and children. Best believe Mother and Child here on Mainland 98.3 FM will address it. We also have Health Plus on Fridays. This is where we focus on the general populace. We're talking to everybody now. Specifically, you can join our Mother and Child Health program on Mondays from 10:15 to 11 a.m. My name is Sage Babalola. We're going to go on a commercial break, and then the Launch Cafe crew will come in. Eric and Lemibe, Victor Achibong, just to hand over the baton of conversation. Rioja Opia would also be here at 11:15 to have conversations on Mainland Business Cafe. So if you're a business person or you just want to have an understanding of the world of finance and economics, you definitely want to listen to that program at 11:15 a.m. And then at 12 noon, I would of course be here to give you the global news. Don't go anywhere. We're at the Sound of Lagos. Thank you for listening.